Hello and welcome back to TCTV on location. I'm here at the Toledo Clinic with Dr. Jason Levine, your sports medicine physician and an orthopedic surgeon. And the first question I have for you is the shoulder. It's a complex joint. Can you explain what a rotator cuff injury is?
Sure. Rotator cuff injury is an injury that happens to one of the four rotator cuff muscles. The shoulder's made up of a lot of different structures, but one of the main ones is what we call the rotator cuff. And again, there's four individual muscles, and it's just a tear to one of those.
And what's the most common injury that you see that brings a patient in?
With the rotator cuff, it's usually a degenerative type injury. Sometimes you can have a trauma such as a dislocation where the shoulder comes out of joint, and that could injure the rotator cuff in an older patient, but most of the time it's just a degenerative injury.
Okay, so we see a little bit of a diagram here, and it might seem a little maybe scary to a patient, but you mentioned that it's a degenerative situation most of the time. So what are some preventative things people can do so they don't end up with you?
Sure. The last thing you want to have is surgery if you can avoid it. And so a lot of the things that we try to do are strengthen the rotator cuff. As I mentioned, there are four muscles. If you have an injury to one of them, if you can strengthen the other three, that'll take the stress off of the one that's injured and allow them to hopefully get back to normal activities.
And if someone doesn't quite know how to explain it or coming to see a doctor, what would you encourage them to do?
So if you're having shoulder pain, so some of the classic symptoms of a rotator cuff tear would be pain with overhead activities. At nighttime when you sleep, you'll have pain that goes down the side of the arm. If you're having these type of classic symptoms, you haven't had a workup yet, going and getting an exercise band from the store, just working on gentle internal and external rotation exercises with something very light and high repetition, so 10 to 15 reps would be a start.
Well, thank you, doctor. That's so much information, but that's all the time we have for right now, and we'll see you back here soon.